This is Margaret, and we are Apprise counselors. Apprise is a program run through the Department of Aging of the State and Department of Aging Services of the county. It is the State Health Insurance Assistance Program, known as a SHIP, in Pennsylvania. Where the name Apprise came from, we do not know. It conveys nothing, but that's what we're called. There is a SHIP everywhere the American flag flies. So if you have friends in other states, tell them to contact their local Office of Aging to find a SHIP to get the services that we offer here. The good news about Medicare is you've got lots of choices. The bad news about Medicare is you've got lots of choices. The good news is there are a lot of people who want to talk to you about your choices. The bad news is they almost all work for insurance companies and want to sell you something. We are a free, independent, unbiased, confidential insurance firm. We do not sell anything. We're here to help you find the right answer for you. And your answer is going to be individual, even it may be very different from one person to another within marriage, okay? The right answer for you may not be the right answer for you, okay? Now, we're trained and certified volunteers, and our job is to provide information. What we're going to do tonight is go over basically some of how Medicare is structured to help you develop the questions that you want to use. I'm going to suggest that each of you at an appropriate point go for a one-on-one session with one of our counselors. We'll talk about how you do that and where that is.
Okay.
We'll go through. Now, when you please raise questions as they come up. There are several responses you get. I may answer the question. I may say, I don't know. I may say, wait, we're going to cover that later. Or I may say, that's something that's pretty personal to you. Why don't we put that into your one-on-one session with the counselor later? Okay? We have no financial interest in the choice that you make. Okay? Medicare is difficult to understand, and this is something that hits people at all levels of economic resources. Rich people go to talk to their financial advisors who don't know anything either, and they put them in something that says we've got a lot of resources to make the wrong choices. A lot of times the consequences aren't as bad. Okay, first, we're talking mostly tonight about Medicare. Medicare is a federally run program that is for people 65 and over, and for people who've been disabled officially for 2 years, okay? Medicaid is a state program funded in part by the federal government that's for people with low resources and low incomes. It is a vast oversimplification, but if you sort of think Medicare old, Medicaid poor, and although you can be both, then that'll help you with what we're talking about tonight. We're going to talk about Medicare, okay? Who's eligible? People 65 or older. This is absolutely separate from any decision about when to take Social Security benefits. Social Security benefits you can start receiving age 62 or later. That's totally your choice. 65 is when you become eligible for Medicare, okay? Other people are Social Security disability for 24 months, people with ALS, Lou Gehrig's disease, or end-stage renal disease. You must be a citizen or permanent resident. You do not have to be retired to sign up for Medicare. We'll talk later about the dance between if you're still working when you turn 65. Okay, you or your spouse. Okay. Medicare consists of 4 parts, A, B, C, and D. Part A is hospital inpatient, although there are enough exceptions, but basically skilled nursing home care if you're being rehabbed after you've been in the hospital. Remember, Medicare does not cover custodial care. If you're in the nursing home and you're not getting rehabbed, you're just there because you need skilled nursing. That's what long-term care insurance is for, okay? Home health care, hospice. This is what is paid for by all those deductions, all those years for Medicare out of your paycheck. If you or your spouse have 40 quarters of credit with Social Security, then Part A is free. Part B is outpatient, doctor's visits, diagnostic tests, all those things you see there, emergency room, observation stays. That's when you're in the hospital where you're not admitted as an inpatient. We'll talk later about that. Always something to keep an eye on. Everyone pays a Part B premium every month. Okay, if you are receiving Social Security benefits, it is taken out of your Social Security check. If you're not receiving, they bill you quarterly. Okay? There is almost no circumstance under which you should not, when you're on Medicare, be signed up for both Parts A and B. Okay? Okay, what doesn't Medicare cover? I always say if it's a hole in your head, then Medicare doesn't cover it. No dental, no eyeglasses, no hearing aids. Okay? Cosmetic surgery, again, long-term care, acupuncture, anything outside the U.S. Okay? Again, we'll come to some exceptions for that later, but basically, if you travel outside the U.S. and all you have is original Medicare, you need to buy travel insurance. Actually, you probably do under almost all circumstances anyway. Okay. Healthcare reform, Obamacare, the Affordable Care Act. 3 names for the same thing. We are not going to discuss whether it's a good idea or not here. We're going to discuss this relationship. If you're eligible for Medicare, it is illegal for someone to sell you and illegal for you to buy a policy on the healthcare marketplace. Doesn't matter if you're working, not working, whatever. When you turn 65, you're out of buying one on the marketplace. That does not keep you from receiving it from a group plan sponsored by your employer. But in terms of the marketplace, you have to transition to Medicare. Okay, exception is those not eligible for premium-free Part A.
When can we ask a question?
Yes.
What if it's the other thing is better? You can't. What if there's something better than Medicare you can't buy it? You saying?
Medicare.
Right. And you say you can't buy something else
On the
of
marketplace.
Right.
You have to use it.
Okay.
And
We'll
the
talk-
marketplace doesn't get better than Medicare? Is that the?
Well, in most cases not. We'll go over that a little later, okay? But the answer is no, you can't. Yes, no. Okay. Okay. Now, how do you enroll? If you're receiving Social Security disability, supplemental security income, Social Security Administration automatically enrolls you and ships you out your card. Okay? For other places, yes, just to keep you confused, remember this is totally separate from when you receive Social Security benefits. However, one of the places you can apply for Medicare is on the Social Security website, just to keep you on your toes there, okay? You can apply during a 7-month period. The 3 months before my birthday is in October, and so when I went on Medicare, I could apply in July, August, and September, the 3 months before my birthday. October, the month I turned 65, or November, December, and January, the 3 months afterwards. Those would all have been timely. What you generally want, particularly if you're transitioning from another kind of insurance, is to have it all arranged ahead of time so that it takes effect on the first month of that you turn 65. Our birthday is in October. My Medicare became effective October 1st of that month. So it's better to do it ahead of time. Okay. Now, Medicare card. Okay, that's the old Medicare card. If you have one, shred it. Or at least watch it very carefully, because again, it has your Social Security number on it. Somebody gets hold of that, they are 90% of the way to stealing your identity. Okay? These are the new ones. Everybody in Pennsylvania should have gotten one. Is there anybody, who all here is not already on Medicare? Okay, good. That's good. Yeah, because now every year, once you're on Medicare, you get one of these. And it has all the information I'm going to tell you. It is, however, not arranged for maximum ease of use. And in fact, it's a good cure for insomnia. Okay. Okay, Part A. If you've worked 40 quarters, there's no premium. A lot of people sign up for it even if covered by a group health insurance plan. The people who should not do that are anybody who are involved in a health savings account, which is not the same thing as a health reimbursement account or a flexible spending account. It is with a high deductible, officially high deductible. You think my deductible's pretty high where I work, but are there any people here who have a health savings account? That's something that goes goes into a bank account that you own.
I'm not sure.
Okay, find out
Yeah.
before you sign up for Part A. Because what happens the minute you sign up for any part of Medicare, no one can make any further contributions to your health savings account, either you or your employer.
Tom,
Yes.
if you have an HSA, a health savings account, usually you get like a credit card that's particularly for that you can draw on.
Yeah.
That,
A lot
so
of
I don't know if
times-
she doesn't has to have that.
Yeah, if, it's in an account that you own. It doesn't go back to your employer at the end of the year, anything like that. It's your money and you keep it. Okay, so find out.
Yeah.
Okay, all right. Okay, you cannot join Medicare. Now, what happens is that there's a 6-month look back. So it's for 6 months before, what they do is they go back and look 6 months, and they say, you can't have put any money in for 6 months before you signed up for Medicare, okay? So check carefully and see an apprised counselor before you sign up for Medicare, and check with your HR department or whoever to talk about, do I have an HSA or not, okay? Health reimbursement account, which is one of those things where your employer supplies the money, but it goes back to the employer at the end of the year. That you can have and still have Medicare. Okay. You want to sign up for Part B when you first become eligible, except if you are covered by insurance that comes from the employment of you or your spouse by an employer with 20 or more employees. Okay? So you work for, what,
SAP.
What, SAP, right. They got more than 20 employees, okay? Okay, you're working for them, you're gonna continue to work for them. You're gonna continue to get your insurance from them, okay? Yes.
What's Part B?
Part B is the part that's outpatient, doctor's visits, diagnostic tests, that sort of thing, okay? Okay, in which case, all the things we say about what happens at 65, you in your mind say, or when I stop being covered from active employment, i.e. COBRA doesn't count in terms of delaying when the penalties start. So suppose your company gets bought out, and you get a tin parachute. We never meet the folks who get the golden parachutes and these things, but you get a tin parachute. And they say, if you take this buyout thing, then we'll pay your health insurance for a year. You know, that's part of the let's get rid of you package, okay? That doesn't stop the penalties that come from not signing up for Part B on time. We'll go into what those are later. Because at some point, when you sign up for Part B, there'll be a form that goes to the company you work for and say, what was the last day this person showed up and worked? So it doesn't matter if it's COBRA or a tin parachute or whatever, that does not stop the clock from ticking on how soon you have to sign up for Part B. Okay?
There's one question.
What?
There's a question here. So you say you may delay enrollment in Part B.
Yes.
But you're saying is you cannot have Part B. You must delay.
No.
No.
So you must delay Part B if you are working
No,
actively
you
employed.
do, no, if you are covered by insurance, then you have no reason not to delay Part B because you'll be paying essentially, in most cases, for the same coverage twice.
No, I'm saying this, if you are covered by insurance, you can cancel the employer insurance coverage and take this.
Do you know that, the answer to that, Margaret?
No,
Okay,
I think the issue is not to pay your Part B twice.
Right, so yeah,
If you're employed and the employer has the B coverage in your insurance,
right.
don't buy anything else. It would be paying for something you've already got.
But the employer is charging too much money, so we can discontinue the employer payment.
If
And-
you're gonna stop the employer insurance,
Yes.
you can do that. And then you would want to buy B,
yes.
So when
And
can
what
you-
else?
which
when-
is $134.50 a month now.
So if you do that, then they will send a letter to the employer, and
Yeah.
the employer will say, no, he's still working.
No. If, all the employer has to say is he's not covered by our insurance, okay?
You could
No matter
still
if
be
you're working or
working,
not.
but
can
you're
be
not covered by the insurance that the employer has.
Okay, yeah,
And you can always sit down with an apprised counselor and sort this out again when it becomes very close time for you to have these go into effect. Saying, I've been to class, I've read this stuff, now make sure I understand what I'm doing.
yeah.
Human relations departments, as a rule, don't do a real good job on helping their retirees get insured properly.
Again, we're talking about Part B, but I don't see a slide on here where it says what it actually covers.
Well,
Yeah,
let's-
not yet. Wait by it.
Not yet.
I went back by that too fast. If you look at
Page 4.
page 4,
Oh.
thank you.
Yeah.
Somebody's faster than I am, which doesn't take much. The top of page 4,
Okay,
okay?
okay, thank you.
Okay.
Didn't work it.
Okay, when you stop working and you're gonna sign up for Part B, you have 8 months, okay? The time coverage ends or you stop working, whichever comes first. Okay? Now, if you have already signed up for Part A and you then want to sign up for Part B, this is the only part that can't be done online, okay? You have to find these forms online or at your Social Security office, fill them out. The CMS L564 is what goes to your employer. And then get those and physically take them to the Social Security office. Okay? There are 2 Social Security offices sort of in our vicinity. One is in Westchester and one is in Royersford. And if somebody in Royersford says, oh no, you're from Chester County, you have to go to the one in Westchester, please get their name, let us know, because the regional director who spoke with us said, I want to find out anybody who's doing that, because that's not true. You can go to any Social Security office you want.
I went to Morrisford.
Yeah.
You often can get an appointment in Royersford sooner than you
Right.
can in Westchester.
Which is not saying much, but yes.
So-
Well, it worked for me when I needed to do
Yeah,
it.
no, I'm
So
just
for me
saying,
too.
I'm just saying, Westchester is notoriously
Yeah,
crowded and understaffed.
yeah.
Okay?
So you need appointments for any visit to the Social Security
Yeah.
office?
Yes,
Yeah,
usually
well-
better ahead of time. You can also walk in, but then you're taking your chances. Okay?
I had called Social Security office, they say you must go to Westchester.
Tell them they are wrong.
And Social Security, I called on the phone.
Yeah, no, you don't have to, you know. I mean, you know, if they're gonna have one that's only gonna serve Montgomery County people, why would they put it in Royersford, you know, on the edge?
Right.
So, okay, so you fill out this form, and that goes to for the employer, okay? Together, okay? Can be taken to any Social Security office. Okay, suppose you don't sign up on time, okay? For Part A, if you have enough quarters for it to be premium free, no problem. You know, hi, you didn't take the insurance, we're gonna offer you for free for a couple of months or a couple of years. We're gonna let you get away with that, okay? You know, if you don't enroll Part B, then you can sign up during the first quarter of any year, but your coverage doesn't begin till July. That's because they don't want you saying, I'm only gonna pay for it when I need it. No insurance plan in the world can operate on such a system, okay? If you don't sign up for Part B when you're eligible, then there's a penalty. For each full 12 months that you could have had Part B, then your monthly premium goes up 10%, and that is with you as long as you are on Medicare. Okay? So it's $135.50, between $149.05. Now, we come up with folks who, I never signed up and I'm $75.80 now. Their Part B premium gets pretty big pretty fast, because it's compounded. It's 10% and then 10%, yeah, so, okay, yes.
I never signed up, it was just, when I was, like 2 months before my birthday, they just sent me a letter saying that they were taking this out, and they now take it out of my
Were you-
Social
were
Security,
you-
and I have a card.
Yeah, were you receiving Social Security?
Yes.
See, that's what we said, when you're receiving
So
Social
it's an
Security, they
automatic.
automatically do
So
that for you.
I am in it, I'm not.
You're in it, you look on your card, if it has a
Yeah,
Part B
it's-
thing, you're
yeah.
all set. Okay. How much does Medicare cost? no premium if you or your spouse has worked 40 quarters or 10 years. Does not have to be continuous, okay? It can be here or there. Just get 40 quarters. Otherwise, it's a sliding fee scale. If you've not paid in just Social Security at all, it's $437 a month. Okay? So then, now, $135.50 a month if you roll in 2019, unless you're in the top 5% economically, if your income is above $85,000 single. And this is your adjusted gross income. It's the number that used to be at the bottom of the front of page 1040 and at the top of the back page. But of course, they've moved everything around this year. But your adjusted gross income, or $175,000 per couple, then you will have a surcharge. Okay? Now, the look back is 2 years because that's the last figure for how much you earn that the Social Security Administration has. It's 2019. Until you file your tax return, they have no idea how much you earned in 2018. So what they're going on is 2017 figures. Now, the problem with that, of course, is that a lot of people's income makes a sharp dip when they stop working. You know, because once you stop working in a place, eventually they stop paying you. Okay? So, what you do is there's a form, and we can help with that sends in, that says, hi, this is what my income is actually going to be for 2019 or whatever year you're talking about. So there's a way to get around that so you don't get stuck. Now, what happens if you win the lottery? For that particular year, your income goes way up. You're subject to the surcharge. Next year, goes back down. Okay? But, you know, it's dependent on your income every year.
And that's the adjusted gross income, right?
Adjusted gross
Okay.
income, yes. Now, Medicare deductibles and copays. The nice thing about Medicare is you will go to any provider that accepts Medicare. And that's the vast majority of providers. Down on the main line, you'll find the boutique doctors who, you know, hi, you give me $5,000 and you can come in on a basis, but you pay. Doctor cannot charge more than Medicare allows, okay? So your doctor can't say, well, I'm gonna take Medicare's money, but then I'm gonna take extra money from you because you're rich and I'm fabulous. So with those boutique doctors are just out of the Medicare system altogether unless unless you've got lots and lots of resources. That's not good. Okay.
Do you have any idea what percentage of physicians don't accept Medicare?
Very small, I think it's in the single digits, yeah. And around here, because generally they have to take, they take care of them. Yeah. Hi, come on in. The water's fine. Hi, come take one of these, please.
The commonest ones that don't accept Medicare
Here.
are often psychiatrists in private practice
Okay.
and neonatologists, the ones that take care of the preemie babies in the nursery. They're not gonna have any Medicare patients,
Right.
Hi, come on in, please.
because their population is almost all Medicaid.
Well, please, we're gonna hand those out later, okay?
Oh, I'm sorry. I was helping someone move and I'm in pain,
Okay.
so.
So
Here.
the
Go ahead.
likelihood
Sit with the
of
back.
the majority of physicians is
Here.
that they will accept Medicare. And if
Yes.
they don't, they have to post it prominently where you can see it. It's not something they can spring on you.
Now, deductibles. Hospital deductible under Part A is $1,364. You walk into the hospital, the first $1,364, Medicare doesn't do anything about. Now, if you know anything about hospitals, that covers your first 10 minutes. Okay? But that's only within a 60-day period, which is called a benefit period or a spell of illness. Okay? So, you go in for a broken leg, and then 59 days later, you go in for, something entirely different, rash, some sort of something else. Okay? No new deductible, same spell of illness. You go in for a broken leg, and 61 days later, you go back because you broke the same leg again, same thing, new spell of illness, another deductible. If you are the unluckiest person in the world, you can manage to rack up 6 deductibles in the same calendar year. It'd be hard, but you could do it, okay? Now, after you've been in the hospital 61 to 90 days, then there's a copay, goes up after 90 days, and all days after 150 you pay all the costs. Now, obviously, that's very, very rare. Very few people are in the hospital that number of days, but those, now, Part B has what?
So for up to day 60, there's no copay.
No,
So if you are 60 days in there,
Yeah.
you pay only $1,300
Yes.
for 60 days,
uh-huh,
which is a good deal. It's like $20 a day.
yes. Well, except the fact that you're in there, you're unlikely to be there 60 days. Most people are in, what, a couple, 3 days.
3, 4,
I
5.
always used to say, you get to stay as many days as in the hospital as you've had limbs removed. So, so, Part B, the annual deductible is $185. Now, there are proposals to radically raise that because there are a number of members of Congress who believe that you seniors have it way too good. You don't suffer like they do. So, they want to raise that. And then, of course, you've seen all,
So if that is raised, if you're already in a plan, do your rates stay the same or will they go?
Depends, we'll talk about that a little later, okay? Okay, also, Part B only pays 80%. You've seen all of the ads on TV. Did you know that you could pay up to 20%? Okay? Okay, the exception is preventative services, and we're gonna hand out booklets about what preventative services are covered in. Preventative services under almost all Medicare plans are covered with no deductible and no copay. Okay? Okay, this is the most important slide we will show all evening. And you can tell it's the most important because it's going to come by 3 or 4 times. Okay, basically, what you can do, original Medicare, Part A and Part B, is the only part done by the government. Everything else here is done by private insurance companies. And you can basically go down the left column or go down the right column. And, they don't like me telling this joke, but, basically, people say, which one is the better one? And the answer is the same answer that often you get when you ask an older gentleman if he wears boxers or briefs. The answer is, depends.
Thank you.
Okay? So, we'll talk about each of these, but you can't mix and match. And also, it is a lot easier to go from right to left than to go back, from left to right than it is to go back right to left. Okay? So, we're next going to talk about Medigap or Medicare supplement policies. How many people on Medicare know which kind of policy they have? Okay. Okay. How many people on Medicare don't know which kind of policy they have? Okay, good. Now, when you retire, Medicare becomes primary. Okay? And there are different retiree plans. There are employer-sponsored retiree plans. That is unfortunately, decreasing proportion of the population. You worked for Amalgamated Widget for all those years, and they provide a plan that supplements your Medicare. You know, or you belong to the United Widget Makers Union, and they have something that covers you in your retirement. There's federal retired employee insurance, state, like SERS, isn't it called? Retired public school, or TRICARE for life. These are people who have made the military a career. Okay. Note for all of these, you need to sign up for Part A and Part B. Okay. Enough of this yet. Now, special note to veterans: you can have Medicare and VA, but both won't pay for the same service. What you do when you have VA insurance is there's an excellent VA hospital in Coatesville. So you can say, hey, I can get all my stuff and my prescriptions and all that there. However, the risk you run is suppose Coatesville goes away in some future redoing of the VA hospital system, they close Coatesville. Or you move to be close to relatives and you're not near a VA thing. Then you haven't signed up for Medicare and you have all of the penalties associated with not signing up in a timely fashion. So that's why veterans need to think not only now, but what might I want to do in the future when I make that decision. Okay, Medicare, sold by private insurance companies. They're regulated by the insurance department, so if they ever want to raise rates, they have to get permission from the Commonwealth of Pennsylvania Department of Insurance. Covers gaps, deductibles, Part B. There are 11 plans, lettered A through N. This has nothing to do with the 4 parts of Medicare, lettered A, B, C, and D.
Right.
Okay? This is, so, here, can you hand this lady one of these, please? Hi, this is for you. Okay? You have to have a Medicare A and B in order to purchase. Now, every Medigap Plan A covers exactly what every other Medigap Plan A does. Okay? No change. However, rates vary by insurance company, age, gender, and residence. That is, if you live in the, if you live in the Chester County part of 19460, your rates may be slightly different than if you live in the Montgomery County part of 19460, okay? The rates can change any time, but, you can change your plan anytime, but you may incur underwriting if it's more than 6 months after you join Part B. During the 6 months after you join Part B, you have what's called a guaranteed issue period. They cannot tell you no. They cannot tell you, look at lady, you had 3 bypasses in the last 5 years. We're not going to sell you a policy, or we're going to sell you a policy that charge you 3 arms and 5 legs for the premium. All they can charge you is what they are charging every other person, you know, my case, every other male 70 years old who lives in Chester County 19460. Okay, can't charge for anything else. Okay, it's good for snowbirds because there are no networks. You can go see any doctor anywhere that takes Medicare. Okay. Now, I hope you can read because they didn't, as opposed to when they usually do, they usually send us a let's see. Okay. That's gonna be hard.
Take a break, why don't you, for a few minutes?
Okay. Let's hand out some of the goodies from the table here.
So I was a teacher and I can do HOP. You're saying under HOP that I have to decide
Okay.
between all those choices?
Repeat?
I was a teacher, so I'm eligible for the
Yeah.
HOP program. But under HOP, under all these plans, you have to choose which one of these you want. That's what you're saying.
I think that's true.
What?
And you can always call for counselor assistance and tell them you have HOP. And there are several of the volunteers that are HOP people and have specialized more in HOP and kind of shuttle them to the
Yeah.
people
If I
that know
chose
the
HOP, I
most
didn't
about
have
it.
to make any other choices, but you're saying I still have to choose.
No, I'm saying that often there is a HOP. I don't know with HOP, but we do have a number of retired teachers who are counselors. And they will tell you what. I just do not have fabulous fingernails. I've got to start going for manicure more often. Let me start passing this around, please.
So correct me if you cannot use Medicare if you travel, is that correct?
Outside the country.
Okay, so you wait to 65 so you can travel, but you can't use Medicare.
Well, there are some exceptions, and we'll talk about that in a minute.
You travel.
Okay?
We got that.
Okay, here, why don't you,
I guess we just. Is it really short?
Do you need one? Carmina?
No, I had one.
We need two more back here.
okay,
Thank you.
there.
Thank you, love that.
Now, you notice this, 2016, things haven't changed. Okay, so don't worry about that.
What do you say?
They haven't changed,
Oh,
even though
haven't changed.
that says 2016.
Now, I had a couple of Medicare and U 2019s. Does anybody have one of those that I can give to the people who aren't on Medicare yet?
There's
What does it
another
look
one.
like?
There's a
I
box
didn't-
upstairs.
Yeah, there's also a box upstairs.
Oh, I don't need that, I have it.
Yeah, if you're on Medicare, you get it every year. Yeah.
Every year you get a new one and get rid of the old one. It's just trash paper.
Is that available online?
Yes.
You don't want
You
to
can
put
get
that
it
in?
online, yes. And actually, Medicare and You, I like it because it has a very good table of contents and a very good index. And it's a 5th grade reading level. So it's, even though we call it your own encyclopedia of Medicare,
I thought I had
it's a
two, but
very
I don't-
useful
I don't see
book.
one back
And if
there.
your question is, what does B cover? That's one of the things in the table of contents. What does B cover? And then on page 49 or whatever, it's written out.
Okay, does anybody have another of the Medicare and U 2019s?
Did you pick
I
up
had
one?
two up
Did you-
there.
this thick book, the thick book.
And I don't have one.
No, this one in your pile,
Gone.
on the bottom.
There.
He needs the first for the program. Thank you.
Yeah, could you have
Thank
one of
you.
those?
No, I don't have one.
No, you
Are
have.
you, are you in Medicare?
I don't have one.
Are you on Medicare?
I just started, but I don't have one of those.
Oh, you won't need it, you won't need it, because if you've just started, then you've signed up for stuff?
I'd like to have one of those because I have questions and stuff.
When you're on Medicare, you get one sent to you. And he wanted to give it to people who aren't on Medicare yet. You can also find this online, the information.
Okay, let's go over the various, okay. First is Part A, coinsurance and hospital costs. Every plan covers 100%. Medicare Part B, coinsurance or co-payment, everything covers it except for K and L, which are plans that don't cover everything, but unlike every others, they have an out-of-pocket limit. Okay? So you may be paying more, you may be paying part of what goes on. See, the coinsurance or co-payment is that 20%, which is no big deal if it's a $100 doctor visit.
Right.
But it is a big deal if it's $4,000 MRI. Okay? What? Hospice care, skilled nursing facility coinsurance, okay? Again, that's for what Medicare covers. They don't cover the stuff that's custodial care. Okay, Part A deductible, Part B deductible. Now, we talked about what happens if the deductible goes up. Fact is, if the deductible goes way up, your insurance company is going to be over in Harrisburg saying we need a rate increase in about 3 nanoseconds. Okay? So that's why I say whether it covers Part B, covers the Part B deductible or not, is not in fact all that important because you're going to pay one way or the other. Okay? And then underneath that is Part B excess charges. Okay. You'll see this if you're getting your explanation of benefits already for Medicare. Your doctor, you go see the doctor. The doctor says the price for a visit for me is, with me for 15 minutes, is $500. Because your doctor thinks she's all that in a bag of chips, okay? Medicare says for that kind of visit, the Medicare price is $100. I'm making things very even so it's easy to figure out. Okay, now, your doctor says, no, I really am fabulous. So she's allowed to charge 15% more than the Medicare amount, which is $115. Medicare is still paying $80, so you get to pay the $20 plus the $15. Again, not a big deal on a $100 doctor visit, big deal on a $4,000 or $6,000 MRI, okay? There are 6 states that have laws that prohibit this. Fortunately, you live in one of them, okay? So no provider can do that if you're in Pennsylvania. You're down at the shore, you're in Delaware, you're in Maryland, you're in any state that touches us, or Arizona or Florida that have loads of seniors. You know, 44 states, that can happen, okay? So if you think that you're going to be seeing providers exclusively in Pennsylvania, you don't worry about that. Otherwise, you might.
So what are the 6 states that you can be in where that's not affected?
Do you know any of the others? A couple of them are New England states. We can look that up, you know, when you have, yes.
Why are the asterisks behind, on Plan N and Medicare B 100%? See, there's 3,
Yes. Yes.
I see 1, 2, and 2.
Yeah, well, I think that should be 3 down
Oh,
there.
the bottom one. Oh, well, it
Yeah.
says plan and right, read.
Yeah,
Right.
basically, the only thing that is different, that's not 100% plan in, is you could get charged $20 for office visits and a
Right.
$50, which makes an amazingly large difference in the premium.
Right.
So that's often preferred. Now, again, we talked earlier about how Congress thinks that seniors have it too good and need to suffer more. Plans C and F are gonna go away at the end of next year.
Ooh, really?
You will not be able to buy them after that. If you have it, you will be grandparented in,
Oh, okay.
okay? But unless you turn, oh, and you can buy them afterwards if you're delayed Part B, you know, so unless you're 65 by the end of 2020, you will not be able to buy those two because you need more skin in the game. All you seniors is just going out and having colonoscopies for fun.
Yeah.
So if you're 65 or older now,
Yeah.
it's automatic.
You know, that you can keep that plan if you have it,
If we have it, okay.
okay? Yeah,
So which one is the F and the other one?
F and C.
See,
C.
Okay. This is a very important chart because remember we talked about the guaranteed issue? For the first 6 months you're on Part B, you have a guaranteed issue, which means you have the right to buy any of the policies on the market. Now, let's be clear on what you get. You have the ability to buy a Plan F from Aetna, say that's your choice,
Right.
okay? You do not have a right thereafter to switch to a Plan N from Aetna or to switch to a Plan F from Independence Blue Cross without undergoing medical underwriting, which is very close to pre-existing conditions. So if they ask you some questions about your health, they can refuse to insure you or they can charge you a larger premium. Now, when you have these plans, your premium's gonna go up every year because this year you're getting the 66, age, 66-year-old rate. Next year, you're gonna pay the 67-year-old rate, okay? It's not a huge difference. And of course, they can always go and say, we need for the whole list of premiums to go up because medical inflation has, as it usually does, outpaced the rest of inflation. And so they can go and get that. You would want to look at what the history of raises are for that company, what their rating is as an insurance company. That used to be available through the Pennsylvania Department of Insurance, but then some industry representatives spoke to various people in the government. All of a sudden, they discovered that they no longer had the staff to maintain that website. However, one of the things that the Department of Aging has done is they've bought apprise counselors access to that. So if you, when you have your one-on-one with your price counselor, they can say, this is what the various rates are for various companies. Now, we'll go through that. Okay. You can buy a Medicare policy anytime an insurance company is willing to sell it to you. So suppose you're 70 years old, but you're healthy, you haven't had any major, your health history is boring, you can probably still buy one. And once you got it, they can't take it away. But they do get to ask you questions about your health history. Now, one of the things that we can help with is different companies ask different questions. Suppose you had something interesting happen with your heart 4 years ago. One company will say, have you had anything interesting with your heart in the last 5 years? Another company will say, have you had anything interesting with your heart in the last 3 years? So, you know, we can help you find a company whose underwriting you are likely to meet. Okay? Now, if there's certain kind of health insurance, then you provide special election periods, but you don't necessarily get to choose from all of them. For instance, I had one beneficiary who she was on her husband's insurance that came from his union from when he was employed. He died, the insurance went away. So she got a chance to choose some plans then. Okay.
Question, Tom?
Yes.
What happens if you're in that situation, you lose your existing insurance, and you do have the right, because you lost it, to choose a Medigap plan?
Yes.
What do they do about the pre-existing conditions?
Usually that's not something you get to do at that point. However, you may get a subset of all of the plans that you can choose from, okay? You know, you may not have the whole list available to you.
Because of pre-existing conditions, but they
No.
can't deny you coverage, right?
They can't, there are certain plans that you have a new guaranteed issue plan for, guaranteed issue period for. Other plans you would be subject to medical underwriting, okay? So it may be like A, D, you know, and N or something. But if you want to apply for B or G or something, then you'd be subject to medical underwriting. But the ones that are on that list, and that list varies, that's something we can help you with, okay?
And there are some companies that do not use medical underwriting. Your coverage won't be as rich or as deep maybe, but it will be insurance that you can buy.
Yes.
Could you
Yeah.
define medical underwriting again, please?
Yeah.
Medical underwriting is that they are allowed to take into account your medical history when they make a decision about whether to issue you a policy, and if they issue it, at what price.
Smokers are the really vulnerable ones because they're going to be expensive elders because they've been smoking all their lives.
Now, what to look for when shopping for a Medigap plan, or any plan, actually. One is price, but a lot of people stop there. This is not helpful to them, okay? You want to look at underwriting possibility of the company. You got, you know, Independence Blue Cross, probably gonna be here 5 years from now. You've got Tom's Fly-By-Night Insurance Company of Phoenixville, Inc., maybe not gonna be here in 5 years, okay? And again, there are a lot of companies that offer plans with the names of various fraternal organizations. United Healthcare offers stuff with the name AARP plastered all over it. Those are simply, the insurance company pays money to the people that get to use that name, okay? Those sponsoring organizations have nothing to do with the insurance itself, okay?
But they still have to be approved, right, by,
They have to be approved, but they can leave the market,
okay.
or they, yeah. One of the things you don't, or they can be small enough in terms of how many people they cover in Pennsylvania, that if they have a bad year,
Right, yeah.
their rates really go up. So take a look beyond price. Also what happens is when people choose between Medicare Supplement and Medicare Advantage, there are a lot of Medicare Advantage plans that have no premium whatsoever. But what you want to look at is not just the premium, you want to look at what's it going to cost me to get the medical care that I anticipate having in the coming year. And that can be, that can be a very different total than just looking at the premiums. Okay?
And it applies to what hospitals are covered by a given insurance plan.
Yes.
Because some of the Medicare Advantage plans cover hospital A to B, but I live in the town with the hospital C, and I really, really want to be sure I've got Penn Medicine in the city on my list of doctors, and they may not be on that company's list of hospitals.
Yeah. Okay.
It's like an onion, it's layer after layer after layer.
Okay? Now, if you get a Medigap policy, then you also need to get a prescription drug benefit plan, which is separate. That's Part D. Okay? This is the most complex part. Fortune is the part with the best help available. Because if you're the market for a plan, for a separate Plan D program, there is a wonderful website called Medicare.gov. You'll see more about it as we go on later. And what you do is you go there, you find plans, you put in the list of medications you take, what size, how often, whether you get it by mail or whatever. You push the button and bada boom, bada bing, it comes up with the cheapest plans for you, taking into account the premiums, any deductible, and any copays.
What's the site you said?
Medicare.gov. You'll see it prominently featured as we go through the rest of the, okay?
What if you're
Upper left corner on the website,
Yeah.
upper left corner, find a
Yes.
plan.
Somebody was asking a question.
Yeah. Okay,
Yeah.
what if you get sick and your medications change? Is there an enrollment period where you can change Part B?
Every year from October 15th to December 7th, you can choose a plan for next year. And these, what we just covered, the plans, the supplemental plans, the Medigap plans, those are the only things that are pretty much set it, forget it. Every other part of this we're gonna talk about, of course, Part A, Part B. But either this or Medicare Advantage, you wanna look at that every year because plans do change radically every year, can. So for instance, if I buy the Humana Super Duper RX Plan 52, okay? There may be a plan next year that's labeled Humana Super Duper RX Plan 52, but it may not have any of the same contents that that plan has this year. And also you change in terms of what you take, so that's why if you have a prescription drug plan, look it over every year. Now,
Question.
if, what?
When is the open enrollment?
October 15th, December 7th,
Okay.
okay? Yes,
Tom, what happens if after you sign up, you change where you live? So you sign up here in zip code 19460, and then 3 months into the plan, you move to Florida. How does that affect the rates
generally,
and the coverage?
generally, it just comes up when you renew. But, again, check, it may, if you have with a prescription drug plan, there's probably not gonna be much of a difference, except that you may find that the pharmacies are not the same, and that may affect how much you pay, okay? With a Medicare Advantage plan, you need to check because some Medicare Advantage plans have networks that are more regional, that cover the far corners of Chester County. Or there are some that, like the Blue Cross plans, that are pretty much national. So, when you move, you need to check it out, okay?
Do some of the drug plans have annual caps on your out-of-pocket?
No,
Not like the, you mentioned those other two plans on the DaVita?
no,
Had caps on their K, no?
no plan, no caps,
Okay.
okay?
One more question on this. This prescription D plan, you know, you have to have this from the same company who you buy the
No.
Medicare?
No.
Or it can be
Being
separate?
totally different, okay? And again, remember, everything is individual, so just because you're married to somebody does not mean it's gonna be less than for you to be on the same plan.
She and I can have different plans?
Yes.
Right, okay.
Yes, and,
Becomes critical with some of the diabetics, because their drugs are changing price practically by the hour. And so what plan they're in, and the need for them to look at their plan every year is critical.
yes, that's sort of why I do this, is I saw a beneficiary who was on a particular kind of insulin. We switched her to a different plan for the coming year and saved her prospectively $13,000.
Wow.
In terms of co-pays. Yes.
I'm not sure which of these this relates to, but it's the question about the companies. My spouse is a retired federal employee, so has the federal, it was called FEP Blue, it was Independence Blue Cross Blue Shield. All of a sudden, the correspondence started coming with no, as far as I understand, no letter to say we're making a switch here. Now it's coming as Highmark Blue Cross Blue Shield.
Yeah, that could be,
'Cause
one
you
of,
said
one
usually
of the
the
Blue
Blue-
Crosses bought another one.
But then presumably, do they have an obligation to grandfather?
I have no idea. The dance between Medicare and federal retiree insurance
It's complex,
is
I know.
especially complex. And we do have a couple of folks who are retired federal employees. So that would be the kind of thing you'd want to talk and say, I want to talk with an apprise counselor who can handle federal employee stuff, okay?
Okay, and
You
then
might
get
have to go
paperwork
to a
together for that.
location
Yeah.
in
Thank
another
you.
part of the county.
Okay,
But,
thank you.
Okay? Okay. There's a deductible if the plan has one. The nice thing about that website is it'll figure out whether it's gonna be cheaper in total for you to take Plan 1 that has no deductible, but a higher premium and copay, or Plan B that has a deductible and copay. It'll figure that all out for you. Then there's initial coverage limit. That is the amount, that is up to usually about $3,000 worth of drugs, $3,007. That $3,000 includes what you pay in copay and what the drug company pays. Remember, the drug company does not pay retail price. The drug company has an agreement with the drug manufacturer for a special deal such for, just for you, price. So that's what goes into that initial coverage of it. Now, next comes the coverage gap, which was called the donut hole. When Medicare first started covering medications, that was simply a period of no coverage whatsoever until after you'd spent a real wad of money, you got into catastrophic coverage, okay? And there are two main effects of the Affordable Care Act, Obamacare, healthcare reform, on Medicare. One is a huge enlargement of the preventative care that's offered with no deductible, no copay. And secondly, the doing away with the donut hole. As of the end of this year, unless Congress changes things, there will be no donut hole, okay? You will continue paying about the same rate, which is usually about 25% of the cost of the drug all the way through. Now, once you've put out something like $7,800, $8,000 in drugs, and remember, a number of people reach that by the middle of January, then you go into catastrophic coverage, which has minimal cost sharing. Okay? Okay, what's not covered under Part D? Things that you go to the doctor's office for generally. I mean, I have a friend who has to go and get shots in the eye for macular degeneration, MS insulin pumps. They're covered by Part B. And if you've got a Medigap plan that covers your co-pays under Part B, that'll cover that. Medicare Advantage depends on your plan, okay?
Mostly over-the-counter stuff
Yeah.
is not covered.
Okay, when you join, when you're first eligible for Medicare, or when you stop getting coverage from an employer plan, it's just we talked about, you can switch annually. You need to look at it every year, and we can help with that, because your plan may change. The premiums may change, the tier, the amount you pay for, say, I've invented this drug called Feel Good or All, and it may be a, preferred brand with a relatively low copay this year, but the insurance company may change it to a much higher copay, much higher tier next year, okay? So that's why every year you need to take a look at your Part D coverage. Okay, if you have a Medicare Advantage plan and they offer drug coverage, you have to take that plan's prescription drug plan. You cannot say, I'm going to take this Medicare Advantage plan here and have a separate drug plan. And it is very important that you don't do that, because the people who run Medicare are people of great faith. They think you know what you're doing. So suppose Tom here has a Medicare Advantage plan and then signs up for a separate Medicare drug plan. They say, oh, Tom must have decided he wants to drop his Medicare Advantage plan and sign up for the Medicare drug plan. And they will disenroll you from your Medicare Advantage plan and enroll you in the prescription drug plan, and then all you've got is original Medicare and the prescription drug plan and nothing in the middle. This does not generally end well, okay? So, remember that the only part that has any medical underwriting is the Medigap plans. Medicare Advantage has no underwriting. Prescription drug plans have no underwriting, okay? There are some special enrollment periods. Now, if you have creditable drug coverage, say about 3 times fast, then you don't have to buy a prescription drug plan. That means if you have VA, you have coverage that's as good as the standard Part D plan from your employer. If you have one of the plans that help in our state, like PACE or PACE-Net, it's all good. Also, check with us before you do this. The COBRA works for not having a Plan D penalty. It does not work for having a Plan B penalty. You say, that doesn't make any sense. And I say, you're trying to apply logic to the Medicare system. That's so cute. Okay.
Do you have to buy the prescription drug plan from one or the other? Or do you have to have it?
You have to have a prescription drug plan, or else when you finally get it, you will pay a penalty.
Okay.
All right?
Forever.
Again,
Yeah.
the idea is they don't want you buying coverage as you get
When you
into
need it,
the,
okay.
as you get into the ambulance, okay? No insurance plan can take that, okay? Okay, if you sign up late, you have a penalty. Generally, it would be about $4 that add every month to your plan's monthly premium if you sign in a year late. Again, one of the tragedies, we have people who are in their 80s who never sort of caught on that Medicare drug coverage was added in 2006. And all of a sudden, and you know, they didn't take much or anything in the way of medications. Well, all of a sudden, they're in an age when that changes and can change quickly and radically. And so they have quite things.
Part D is given by the private insurance company.
What are you?
The Part D is not by the government.
No, government, no. Part A and B are the only thing that does.
So then, how is the rate fixed, $4 penalty? Is it for across all the insurance companies?
Yeah, it's, yes.
Okay. They just come to the agreement that all of them have.
The
No,
penalties.
the government sets the amount because it says this is how much the standard insurance plan is, and this is a percentage of that, okay? So,
Can PACE help people who have fallen into that problem?
PACE, if you're on PACE, then yes, you will, you go on PACE and you no longer have your own Part D plan. They will assign you one and you can choose one, but you know, if you're on PACE, PACE is a program that is run by the state. It provides help for people with low incomes with their thing. It is one of the few plans that does not have an asset limitation, by the way. Okay. And PACE Net is for people who have just a little too much income to get on PACE. Okay?
And if you're on PACE, then you're on that forever?
No.
Or can you rejoin Medicare Part D, but then you would have the
Well, you
penalty?
only want to if you lost PACE coverage, but if you suddenly,
But then you pay the penalty?
yeah.
Thank you.
Okay, and again, for those with high incomes, there's a surcharge for their premiums. Again, let's look back 2 years, work with us, we can help you so that you don't get charged based on what you earned 2 years ago, you get charged on what you're earning now. Okay, compare based on the drugs you take, Medicare.gov. Okay, what happens is the plan you had this year was the best plan for you this year. The plan for next year may be different because somebody new has come into the market or its plans have changed. The drugs you take have changed.
Can you switch the company then?
You can switch every year. You know, you sign up during open enrollment, October 15th to December 7th, for coverage that begins January 1st of the following year. And you should examine it every year. You may not change every year, but you should examine it every year.
How far in advance of that October date is the information available so you can start?
Not very.
comparing?
They're supposed to have all their stuff in by October 1st. A, they don't. B, sometimes they make mistakes. So that's why you can't really do much until open enrollment happens, okay? All right. Now we're going to talk about Medicare Advantage. Now, Medicare Advantage is an alternative delivery of Medicare. Basically, what insurance company haven't I used? Is it Cigna?
Cigna.
Cigna, okay, Cigna. Cigna goes to the government and says, I can cover this, Tom. You know, we can offer him all the things that Medicare A and B offer. We will have our own set of premiums, deductibles, and copays. But we can offer him all that, and we can, we can do it in a way that's more advantageous to him, and a way we can still make money off of this. So, what happens with a Part C or Medicare Advantage plan is you still have premiums, deductibles, and copays. When you have a Medicare supplement plan, you've pretty much, once you pay the premium, you've often pretty much finished paying for your medical care. When you have a Medicare Advantage plan, you've only just begun, as the song says. And so that's why often premiums for Medicare Advantage plans are lower or even zero.
So how can they be zero? Because they do some service still to you.
Because they're getting money. Basically, the Medicare is giving them how much they figure they'll spend on average on someone like Tom, his age and gender. Okay? So getting money from Medicare, they're not getting money from you, except if you use it. Insuring your health is much like insuring your car. Okay? You can buy a car insurance plan that has a high premium, but very low deductibles, covers most everything. If you get into an accident, you don't pay much at all. Or you can buy one with a very low premium, but if you're in an accident, your deductibles are high, you're going to pay it. That is, every time you use the insurance, you pay a lot. Or you pay with the premium. When you use the insurance, you don't pay very much. It's the same thing with your health. Insurance runs on the you can pay me now or you can pay me later plan. Okay? Now, which is right for you? Depends. You can have two people, both named Tom, who are identical twin brothers with sadistic parents who both named them both Tom, and you are someone who really likes to have your life planned, to have a budget, and you don't want any surprises coming out at you. So for you, it may be the better thing to buy a plan with a relatively high premium that in case you have to use it doesn't change very much. There's no surprises. The thought that there might be a big medical bill hiding in your future really would bother you, okay? So you want to buy that. You, with the exact same kind of medical history and, as far as we know, medical outlook, are someone who says, I've got some money in the bank. If I had a $5,000 medical bill come out and smack me, that would mean that we'd spend a week less at the shore rather than we'd be eating dog food for the whole year. And I don't want to give the insert expletive of your choice insurance companies any more money than I have to. So for you, it might be better to buy a plan that had a lower premium, but where you covered more of the cost when it was used. Exact same medical needs, different choices because of what's going on between your ears. Okay? So that's why all of this is so individual. Okay? Now, Medicare Advantage plans have networks of providers. That means you generally have to go, or are highly incented to go, see people in their network. And one of the things that insurance companies have been doing recently is, in order to keep down premium increases, they've been narrowing their networks. Only the doctors who will agree to take less money. So while Dr. Smith may have been in your network last year, she may not be in your network this year. And that's one of the things you have to research every year. And it's generally, the thing is by calling up the doctor's office or the provider's office. Because we're not just talking about doctors, we're talking about hospitals, we're talking about places where you have diagnostic tests, all that sort of thing. And a lot of plans are going to what are called tiered, spell that how you wish, systems, where you go see Dr. Jones, then seeing him is gonna cost this copay. You see Dr. Smith, seeing her is gonna cost this much. You see Dr. Johnson, then seeing her is gonna cost that much, which is, again, not so much one of his doctors, but it's also true about hospitals. It's true about where you have tests. So the main thing before you sign up for a Medicare Advantage plan is, and this happens every year, check the network. Check not only what the network is, but what the network's gonna be. Because those nice lists of doctors they have online are all real time. They do not tell you that Dr. Schmudfuzz is in the network this year, but is not gonna be in the network next year. Okay? So, and you have to
Tom,
live in the planned service area.
there's a question.
Yes.
A little while ago, I made a lot of phone calls to Medicare about a lot of this. I thought I remembered them telling me that a lot of Medicare Advantage plans now offer in-network and out-of-network coverage.
Okay, it depends on.
You can go
the-
out of
you
network
have-
and still be covered.
Yeah, there are different kinds.
Mm.
It's just like the stuff you have before you go on Medicare. There are HMOs, which you have to go see somebody in their network or they're not paying. There are PPOs,
Yeah, I think it was
preferred
the
provider
PPOs.
organizations. Now, you pay more for that, and generally there's a separate deductible and a whole separate set of copays for people outside the network. Okay? So you're highly incented to stay within the network, but you do get paid something if you go outside the network. Okay?
I don't remember them telling me that. And I know what I have now, we can go out of the network with no penalty, which is good. But
Okay, are you on Medicare?
I have a Medicare Advantage plan,
Okay.
yeah.
Yeah,
But I
okay.
might lose it, that's the whole reason why I have to see
Yeah.
what I can purchase myself if I lose it.
Yeah. Oh, is it provided by, yeah, okay.
Provided by an ex-husband,
Oh, okay. All right.
who's his company, so.
Yeah, it's kind yeah, well, that's, none of these rules may apply if you have employer supplied insurance.
I know there's differences, yeah, I've run
Yeah.
into that, and Verizon does supplement, I even found out how they supplement the prescription plan, and
Yeah.
they do kick in for some things.
Yeah, generally, that's why staying with an employer supplied is often good, even if it's fabulous. If they're kicking in some of the money, it's better than going out on your own, picking something else.
I know, that's what I'm
I
trying to
mean,
tell
that's
him, and
not
his
always the
attorney,
case.
yeah.
Okay, one of the things that Medicare Advantage plans have is a maximum out-of-pocket. After you've put out about $6,700 for a single thing, then they essentially cover pretty much everything that happens. Not the drugs, just the medical stuff. Now, Medicare Advantage plans have certain extra benefits, hearing, vision, dental coverage. Those generally are not that fabulous. I mean, they're not nothing, but you're not getting Cadillac plans for any of those as an addition to a Medicare Advantage plan. But you've got to use that. And remember, you have to use their prescription drug plan. So you have to look at what your drugs are going to cost with their plan. Okay? And again, Medicare.gov can help you with that. Yes?
You may have covered this early, and I apologize, I wasn't here. What do you do for vision and dental if you purchase a Medigap plan? You have to purchase those independently?
You purchase those independently. A lot of times, you find that the cost of the insurance and the cost of what you're gonna pay is pretty similar if you're buying it by yourself on the open market. A friend of mine calls individual dental plans the Christmas Club plan, because it's essentially, you just pay it in and then they pay it out, and for most people, it's about the same. So, yeah, you can look around. If you belong to any groups that offer them, that's a big plus.
Well, I know there's independent dental, which I actually purchased once to supplement what I have, because I had to have so much work done that year.
Yeah.
And that wasn't too bad, that was pretty good actually. But is there independent vision coverage that you can purchase? I didn't even think there was.
I think there is. I haven't looked closely.
I think there's a Blue Cross Vision, which is primarily to buy glasses. That's not gonna do anything with cataracts or with accidents that have trauma to the eye.
Although accidents
But
have trauma
Medicare
to
will
that,
cover
well,
that.
may cover that.
Call Pearl Vision and ask them.
Yeah. Yeah, basically one of the things you can ask vendors, and they're gonna know what's out there.
Yeah, for vision.
Okay?
What happens if you move out of state during the middle of the year?
Middle of the year.
And yet you've got must live in the plant service area, must use membership.
Okay, if you move out of their service area, then you get a chance to pick a new one in the middle of the year.
Also, you're not restricted to October 17th.
No, if you move out and suppose you have one particular one that has, a network that covers the four corners of Chester County, and you move to far off exotic Altoona, then you've got to choose a new one. Okay? So.
With
if
no
you-
penalty.
Is there a penalty?
No,
No, they can't penalize, that would be.
Do you have like a certain time period that you, like a 30-day?
there probably is. And, again, check with your local apprise counselor before you move. Okay?
So you mentioned cataracts. Wouldn't cataracts be covered under A or B?
I think
I
so.
think
Medical
they are,
condition.
they are
Yeah,
because
surgery.
Yeah.
my
Yes.
My ophthalmologist, who I saw this afternoon, says that that's in my future. So, yes.
Medicare covers the cataract surgery wonderfully. I don't think I paid a penny. You're not in the hospital overnight. There's no hospital issue to speak of. And your first pair of glasses after cataract surgery are covered by Medicare, the only pair of glasses that are covered.
Now, about a third of people have Medicare supplement plans. About a third of people have Medicare Advantage, okay? So, right now, the federal government is really pushing Medicare Advantage. So,
Why?
even some of the official stuff, just make sure that you're not getting, again, look beyond the premium. Look at what it's gonna cost you to get the medical care you think you're gonna need for the next year. And I know that's, but the fact is, you've got the clearest crystal ball of what your medical needs are gonna be in 2020 of anybody on the face of the earth, okay? And if you think there's something might be coming up, make sure you're covered for it. Okay, Medicare Advantage plans, HMO, PPO, private fee-for-service, which is if your provider on that day agrees to take it for what you just had done, then it's covered. But there are no contracts. So, Tom goes in and gets, get something done on Thursday, and it's covered, private freezer. Tom goes in on Friday, and the doctor says, oh, we decided yesterday we're not gonna take that anymore, okay? And then there's special needs plans. Those are for people with congestive heart failure, diabetes, ALS, end-stage renal disease. Those are for people with specific conditions.
This choice is made only once in the beginning?
Yes, unless something happens like your insurance company drops the area, or you move,
You can choose
okay,
only
okay.
one, and the rates vary a lot among the four types.
Yeah.
Question, what is a CMS?
CMS is the Center for Medicare and Medicaid Services.
Okay.
Okay, it is a major portion of the Department of Health and Human Services. Okay. Okay, again, there's no medical underwriting, and you can change every year, and you should examine it every year. Okay, here's Medicare.gov. And again, wonderful thing. Find health and drug plans. That's where you go and you find, you can look at the different plans that are available in your area. You can compare them. Again, we can help. You can do it by yourself, wonderful. If you want some help, we're here. Okay. First, the factors to consider. Which side of this can we want to go down? What can you afford? It may be that having a Medigap plan would be a whole lot better, but you'd be eating dog food because of the premiums, and also, again, higher monthly premium, lower monthly cost. When you're working, did you like HMOs? Did you like PPOs a whole lot better? What worked for you? Okay. What's your risk tolerance? The tale of the two Toms here. It's a personal decision. Again, we can help. We're never going to tell you this is the one you want to do. We're going to tell you this is advantages and disadvantages of whatever you're looking at. Okay, here is a chart. Talks about some of the things. Again, Medigap is about the only part of this that's sort of set it and forget it. Okay? Okay, then there are a lot of different programs. Okay, see this bottom thing? If your income is less than $27,500 for a single person and $35,500 for a couple, or even close to that, if you're just a little over, come talk to us. That is the most generous. That's for PaceNet. That is the most generous limits in which you can earn to be eligible for any help. Okay? Again, go down left, go down right. It's a song from way back when I was young. It says, "Don't mess with Mr. A. Okay? Don't try to combine the two, bad things happen. Okay, this is for Chester County. Those of you from Montgomery County, see the sheet we gave you. If you live in Chester County, this is essentially an answering machine. Okay? Then, or you can leave a message there. Leave your name, a short message, and phone number. Also, it doesn't say this here, leave a good time to call you back. We take turns covering it for a day. And we're probably going to check a couple, 3 times during the day. So if you leave a message that says, call me back in the next 20 minutes, that's probably not going to work out. Yes?
Is there an office that you could go to?
Oh, yes. Yes, we will come to that in a minute. Okay.
I have a very quick question for you. So if I would call, because I have once, it kind of ended up a little bit of problematic. Should I say on the line also that I need somebody who specializes in special needs?
Yeah, talk to us about what it's about, because then we can refer it to somebody who actually knows about what you're dealing with, okay? So for instance, if you're dealing with federal retiree stuff, tell us. That way we know. Also, tell us in any case, because then we get a chance to spoon up on it before we call you back. Because it may not be obvious, but we don't know everything.
What are the hours usually?
No, well, usually we're gonna call you back during, you can call that any time.
24 hours a day.
Yeah. Again, it's essentially an answering machine. And you leave your name, short message or phone number, repeat the phone number.
And if you call and say, I need a drug plan because I need to fill a prescription tomorrow, You may be a little late, but call anyway, we may be able to be of some help.
Yeah. Okay, here's some more information. Ship availability for your cousin in Nevada. They can call up and find out how to contact their ship. Okay? And if you think, you do not have to be glamorous as we are to do this work. If you think you might be interested in, there's your chance. And that's it. Now, what questions do you have? Because we're about to reach the limit of everything.
Phone
Yes.
number from Montgomery County, is there a separate phone number?
Yes,
Where you could go.
absolutely.
Well, I asked them 3 times. You said yes, when you
There.
How far in advance would you recommend coming in to talk with you before you have to make your decisions? A month
I'd suggest a
before?
couple, 3 months.
And my husband's gonna be eligible December, and I'll be eligible in March of next year. Do we come
Yeah.
in together or make 2 different
Yeah,
appointments?
well, you're gonna have 2 different appointments because you're 2 different people and the answers may be different. I can tell you that you probably wanna try and avoid trying to see us during open enrollment, because we're fantastically busy with trying to keep the people, talk to the people who are open enrollment. So maybe before October 15th, or when's he go on?
December.
December.
So maybe
come
in
see,
August or?
Yeah, come see us August, September. Okay, now, where do you see us?
Yes.
Let me go.
Business cards are over on the table
Yes,
that have the locations, telephone numbers.
Yeah.
That's for reaching Montgomery County.
Yeah.
That's not where we see people. We see
Okay.
people by appointment at the senior centers.
okay, if you live in Montgomery County, don't take one of these.
Thank you. We see patrons here at the library every Wednesday
Okay.
from October to December, for example. And many of the libraries are involved.
Chester County.
Yeah. Okay, the reason we divide stuff up by county, by the way, is, now, who's all for Chester County here?
No, this is just
You have the, okay, Chester.
No, I think most of mine are answered. I'm gonna go to that Medicare.gov.
Okay, I would suggest that everybody here make an appointment for one-on-one. Okay? There. Now,
It's okay.
during open enrollment, we have additional sites that we go to. For instance, here at the library, generally we're here Wednesday afternoons, but you have to make an appointment. And the way you get an appointment is you call up the helpline, leave a message, say, I want to see somebody. Call up the place where you're going to go, tell them you want to see an apprised counselor. Make an appointment in advance, because we're not always there, okay? And the senior center is one of the places here in Phoenixville. There's Westchester downtown, Good Sam Church in Paoli, right there on Lancaster Pike. Okay, you've sat through an amazing amount of stuff. Let